I'm about to reveal something that might shock you about the way you slept last night. I'm Dr. Emma Whitmore, and after more than 3 decades as a geriatric physician specializing in sleep and cardiovascular disease, I've examined thousands of spines, reviewed sleep studies on over 4,000 patients, and stood at the bedside of older adults whose decline began with something as ordinary as how they positioned their head on a pillow. And I can tell you with absolute certainty that almost everything you've been told about, just get comfortable, is dangerously incomplete. You've been told that sleep position doesn't really matter, that as long as you're asleep, your body will sort itself out. That comfort is the only rule, except that explanation is outdated. It ignores biomechanics, it ignores airway physics. And in adults over 60, it can quietly set the stage for stroke, heart strain, and cognitive decline. This isn't dramatic exaggeration. It's anatomy, and it could literally add years to your life if you understand it. Margaret was 74 years old when I first met her. Active, sharp. She walked 2 miles every morning and took only a low-dose lisinopril, 10 milligrams daily, for mildly elevated blood pressure that averaged 138/82. She did everything right, but she had slept flat on her back for decades, no pillow support under her knees, chin slightly tilted toward her chest. Her husband told me she snored, like a freight train. She would wake up gasping, but brushed it off. Over 5 years, her fatigue worsened. Her memory slipped. Her blood pressure crept to 152/90 despite medication. Then one night she had a transient ischemic attack, a mini-stroke. The MRI showed small vessel ischemic changes. Chronic oxygen drops during sleep had strained her cardiovascular system for years, all because gravity was collapsing her airway, night after night, reducing oxygen to her brain like a kink in a garden hose. Here's what most people don't understand. When you lie flat without proper support, especially after 60, when muscle tone in the throat naturally decreases, your tongue and soft palate shift backward. Imagine your airway like a soft tunnel made of velvet. When gravity pulls the walls inward, airflow narrows, oxygen drops, your heart has to pump harder, your blood pressure spikes in microsurges dozens of times per hour. The American Academy of Sleep Medicine has documented that backsleeping can worsen obstructive sleep apnea severity significantly in susceptible adults. Not slightly, significantly. And untreated apnea is linked to higher risks of stroke and cognitive decline. If you wake up tired with morning headaches, or your partner says you snore, comment below airway and tell me your age. Because this is the part most doctors don't explain clearly. They prescribe a pill for blood pressure, they adjust cholesterol, but they don't ask how you position your body for 7 to 8 hours every single night. And what I'm about to show you next will change how you think about your pillow forever. He took 25 milligrams of metoprolol twice daily. He believed he was healthy. But every night, his rotated neck compressed vertebral arteries that supply blood to the brainstem. Under a microscope, arteries aren't rigid pipes. They're dynamic tubes lined with a protective layer called the glycocalyx, almost like Teflon coating inside plumbing. When you chronically kink that pipe, blood flow turbulence increases. That turbulence triggers inflammatory signaling, increasing vascular stiffness over time. This contributes to orthostatic hypertension, that sudden drop in pressure when you stand, which increases fall risk dramatically in older adults. The National Institute on Aging reports that falls are a leading cause of injury-related death after 65. Now let's talk about breathing mechanics. Your diaphragm is like a parachute. It needs space to descend when you inhale. In a tight fetal position, knees pulled sharply to chest, that parachute cannot fully expand. Lung capacity is already reduced by about 30% by age 70 compared to young adulthood. When you compress it further, oxygen saturation dips subtly but repeatedly. The heart compensates by increasing sympathetic nervous activity. Think of it as revving an engine all night long. A study published in JAMA examining sleep-disordered breathing showed that repeated oxygen drops were associated with significantly higher cardiovascular risk. Not minor, substantial. And here's what makes me furious. Patients are told their morning fatigue is just aging. It's not just aging, it's physics and physiology. Comment below fetal if you sleep tightly curled and tell me if you wake stiff or tired. I'm going to show you which positions actually support spinal neutrality, maintain airway patency, and reduce reflux at the same time. And I will give you specific adjustments that begin reversing strain immediately. Now we're going deeper because this is where the shift happens. Mechanism number 2 is reflux and silent inflammation. Imagine your stomach like a partially filled water balloon connected to a vertical tube, your esophagus. When you lie flat on your back, especially after 65 when the lower esophageal sphincter weakens, gravity no longer keeps acid in the balloon. Acid creeps upward. Even small repeated exposures irritate the lining and trigger microaspiration into the airway. That irritation increases nighttime coughing, airway swelling, and worsens apnea. The Cleveland Clinic has reported that left-side sleeping can reduce reflux episodes significantly because the stomach rests below the esophagus in that orientation. Not slightly, significantly. Harold was 81 when his daughter brought him in for chronic cough and worsening memory. He slept flat, no elevation, after late dinners. He took 20 milligrams of omeprazole daily and believed that covered him. His oxygen saturation during a home sleep study dropped to 86% multiple times per hour. MRI showed progression of small vessel disease in just 3 years. All because acid and airway collapse were feeding each other like a vicious cycle. Mechanism number 3 is circulation. When older adults sleep long-term in recliner chairs, hips flexed, knees bent, calf muscles inactive, venous return slows. Veins are like one-way streets with valves. They depend on muscle contraction to push blood upward. Without that, pooling increases. Swelling, higher clot risk, fragmented deep sleep. And deep sleep, particularly slow-wave sleep, is when the brain's glymphatic system clears metabolic waste, including beta-amyloid proteins associated with cognitive decline. Reduced deep sleep is not trivial. It's neurological debt. So what actually supports the aging body? Supported side sleeping with a pillow between the knees maintains neutral pelvic alignment. Think of your pelvis like the foundation of a house. If it tilts, the entire structure above shifts. A firm pillow between the knees prevents hip rotation and reduces lumbar torque. Slight head elevation, about 30 degrees, keeps the airway open and reduces reflux. Placing a small pillow under the knees when on your back decreases lumbar strain by flattening excessive curvature. And a 45-degree side recline combines airway stability with gravitational reflux protection. Comment below your current sleep position, back, side, stomach, or chair, and your age. I want to see who's most at risk. I'm giving you exact angles, pillow types, elevation degrees, and the specific configuration I recommend to my patients to restore alignment, protect oxygen levels, and support brain health. This is not about comfort alone, it's about oxygen, circulation, and protecting your brain while you sleep. Now I'm going to give you the complete protocol I use in my own patients over 60, and I want you to listen carefully because details matter. The first component is elevation. Your upper body should be elevated approximately 30 degrees, not stacked on 3 soft pillows that force your chin to your chest, but supported by a firm wedge or an adjustable base that keeps the neck neutral. Neutral means your ear aligns with your shoulder, not flexed forward. This angle reduces airway collapse and decreases reflux episodes dramatically. The second component is lateral positioning. If possible, favour the left side. Place a firm pillow between your knees to prevent pelvic rotation. That pillow should be thick enough to keep your top knee level with your hip, not dangling downward. This maintains lumbar neutrality and reduces morning stiffness. The third component is knee support when on your back. A small pillow under the knees decreases lumbar lordosis and muscle tension. Not optional, essential. The fourth component is mattress firmness. Medium firm, not sagging. Studies referenced by divisions within Harvard Medical School have shown that medium firm surfaces improve comfort and spinal alignment compared to overly soft mattresses. Now let me address objections because I hear them every week. My doctor says sleep position doesn't matter. Bring them the data on positional sleep apnea and reflux reduction. Most physicians, when presented with evidence, reconsider. Some won't. Guidelines lag behind physiology. This sounds expensive. A quality wedge pillow costs less than a single emergency room visit for a fall. A stroke hospitalization can exceed $20,000. Proper support costs a fraction per day. Cheapest insurance you can buy. Can't I just use more pillows? No. Stacking soft pillows flexes the cervical spine and worsens airway narrowing. Structure matters. Eleanor was 69 when she changed from flat back sleeping to a 30-degree left side elevation with knee support. Her blood pressure dropped from 148/86 to 132/78 within 4 months without medication adjustment. Her morning headaches disappeared. Her husband reported snoring reduced dramatically. Her follow-up sleep study showed fewer oxygen desaturations. Not magic. Mechanics. Comment: Elevate if you are committing tonight to adjusting your position. Now listen carefully. Subscribe to this channel right now because YouTube will not show this to people who need it unless you engage. If you don't subscribe, someone scrolling tonight will miss information that could prevent a fall or stroke. Leave a comment with your age and sleep position. Every comment tells the algorithm this matters. Share this video with anyone over 60. Text it. Email it. Post it. Somewhere right now, someone is sleeping flat, oxygen dropping silently. This could change that. I've created a complete healthy aging sleep blueprint detailing exact pillow measurements and setup diagrams. Click the link in the description and join my newsletter to receive it. Bookmark this video. Rewatch the protocol. You now understand what gravity does to the aging airway and spine. Use it. Protect your oxygen. Protect your brain.